So welcome to the first Hemophilia Council of California webinar for 2023. Okay, so that moves us into kind of a related topic, and that is something that we have done some previous webinars about, and many of you may already be familiar with this topic, so I'm not going to spend a lot of time explaining it because we have some other things to get to, but the Hemophilia Council of California is taking a leadership role as one of the organizational sponsors of an initiative called the All Copays Count in California. And the work that we're doing on this is to ensure that when you make a co-payment for your medication, for your blood factor, for any sort of pharmacy type of benefits, that co-payment counts regardless towards your deductible and your out-of-pocket, regardless of the source of those funds. So if it's from a copay assistance program, whether that's via a pharmaceutical manufacturer or a private charitable entity, or even your grandmother or your aunt gives you funds to help pay for your medication, regardless of where the funds come from, we believe that should count towards those out-of-pocket costs. And unfortunately, there's been an increasing number of insurance companies that have been initiating policies called the Copay Accumulator adjustors, where they accept those funds to be paid for your medications, but then they don't apply it to your deductible or your out-of-pocket expenses. And so we are working with a coalition of folks, over I think over 70 patient and provider associations and groups have already signed on to be part of this coalition to introduce legislation this year to help with that issue. We do have a petition that you can sign to just show your general support for the initiative and the policy. And we really want to encourage folks two ways that you can really get involved and help. One, if you have ever experienced this or a friend has experienced this, we need your story. We need patients to come forward and be willing to share their stories if they have experience using copay assistance and then not having it count, and they show up. And maybe you don't even fully understand that that's what happens, but if there's any case where you utilize copay assistance to be able to get your pharmacy, like your blood factor, for example, and then you went back later within that same year and they said, oh, you owe all this money now, that would be an example of most likely an accumulator. So that's a big issue, and then that we would love your help with sharing those stories, and the link is in the chat now. All right, thanks everyone.